Today, in our 20-minute webinar, we are meeting an expert from Wisconsin in the United States, Jill Meyer-Lippert. She started a business for a really good reason. So, Jill, tell us how you even got started with your business.
Well, I'm a registered dental hygienist, but while I was waiting to start my dental hygiene program, I started a job as a dental assistant. And at almost that exact same time, my mom announced that she had been diagnosed with breast cancer. So she went through what was supposed to be 6 months of chemotherapy, ended up being 7 because of some delays of complications. And it was very eye-opening to me to see how many problems she had in her mouth during the treatment process. And how little guidance there was provided for her as far as anything she could do to possibly prevent the issues, manage them in some way, and reduce the discomfort that she was feeling. And I felt very powerless because I mistakenly thought now that I worked in the dental field, I'd easily be able to find these answers for her. And it didn't take long to find out that was not going to be the case. So um, I've realized that there's not only a lack of information from a patient's perspective and from a family caregiver's perspective, but also for us as providers, for both the dental side and the medical providers, knowing what to do and knowing how to help our patients and really approach things in a more proactive way for them.
Wow. So you then started your business. Once you started to figure out how to help your mother, you decided I can help a lot of people.
Well, it was a long process. Sure, her diagnosis was in 1992, but I actually launched side effect support in 2013. So all of those years where I was just trying to learn more, getting more information from patients at our practice, seeing more cases where people were diagnosed with various types of cancer, experiencing the same issues, and not only having problems during the treatment process, but so many of them had long-term problems that they were dealing with. And that really struck me that there's just a lack in this area of care. So I eventually, my dad actually passed away from cancer in 2005. And once I lost him, that was my motivation to take this to another level. So that actually started with a volunteer program that I created, little bundles, little oral care kits. So anybody that went in to the treatment facility where he had received care went home with information and product samples that they could get into their hands and start using right away. Because, and that's one thing that we still carry on with side effect support to this day is
Tell
working
us
with different.
what kind of products are in those little goodie bags other than probably a very soft toothbrush?
Yes, that's a must for sure. A compact head, extra soft toothbrush. I typically have some type of an oral moisturizer in there, whether it be like a spray many times, because so many people have dry mouth issues. I have typically toothpaste that would be free of some of the irritating detergents that can not only increase dryness of the tissue, but maybe increase their risk for developing mouth sores. A very soothing rinse. Most of my kits have, there's a company called Closis, and I use the Closis sensitive rinse, which a lot of people really like and feel it's helpful for them. Some of my
I'm
kits will
one of
have,
them.
yeah,
I
will
love that
have,
rinse.
it
Could
is,
you,
it's a
like,
great
so you
product line.
mentioned Closest. I mean, please tell our audiences what products, what toothpastes would you recommend when you're going through treatment and dealing with sensitivities?
Well, and I know it's a challenge because being in Wisconsin here, our what's available here might be different for the UK or other, European countries, but it does appear that Closest does have access in Europe. Another company that I work a lot with is Spry. They're xylitol-based products, and they're very gentle. A lot of them have aloe in them as well. Squiggle is another one. It has kind of a silly name, but it is very, very mild in flavor. That is one thing a lot of people will report, especially after a head and neck cancer situation. They may have sensitivity to flavors and things like that. So all of a sudden, mints or some of the other flavors on the market may feel too intense or sharp for their tissue. So these have really mild flavors. Also using a child's flavor sometimes can be beneficial for people if they struggle with that. So a bubble gum, a berry flavor may work better for them.
Very interesting. And what ingredients would you not recommend?
One of the big ones is a detergent called sodium lauryl sulfate. It is uh, f- basically a sudsing agent. It's something that helps to give that toothpaste or whatever oral care product that is in a nice consistency. So a lot of times that will give you that nice foaming reaction where it really feels like you're cleaning well, then getting the foaming. But unfortunately, that is a skin irritant for many people. Even for people that aren't going through cancer treatments that may deal with canker sores and have trouble with that, or a lot of like burning mouth syndrome with hormonal changes or vitamin deficiencies. That is a chemical that can really trigger some of that. So if somebody is prone to dry mouth, if somebody's prone to oral mucositis, the mouth sores, that can come along with radiation or chemotherapy or some of the other medications that are used, that can sometimes be a tipping point to start that inflammatory process for them.
Ooh. And so so I think you make a really good point that when people get out of the hospital, there's just there are no resources. We have to start from square one, maybe call our dental office. So what are you doing to get products to patients when they get out of the hospital or starting in a timely manner? How do you do that?
There are various hospitals that I work with that we actually provide oral care kits for their patients. And many of them are funded through, it could be the foundation that's connected with the hospital, or sometimes they're funded through an outside nonprofit, or if the department itself has a small budget that they can work with. I can work with the team to create a bundle that fits their needs and the needs of their patients. And then as soon as that patient is starting treatments, they are handed this package that has information in it, and it has the product samples that they can start using right away. And I think that's so valuable because it's unrealistic for people when you're number one, you're not feeling well. You're on sudden time constraints, you're on sudden budgetary constraints, and to be put in that position now, I need to go from store to store to be looking for these different products and figure out what I need to use is so much easier if they can just go home, start using them right away, especially start using them early. I think that's one mistake we make is a lot of times we wait till the problems start and then we start making changes rather than making changes before the problems start. Even if we can't avoid them from starting altogether, if we can delay how soon they start in the treatment process or minimize them in some way, that's a great benefit for the safety and comfort
A
during the whole
real
journey.
That is brilliant. The idea being the care team before once someone's diagnosed and before they have their treatment to get them on some kind of less inflammatory products in their mouth to reduce the possibility of something developing. Gosh, that's brilliant. So if people want some resources, if they're in that position right now or they know people they want to help, do you have on your website some free resources that people could see?
We have many free resources, and that was really, really important to me that I want side effect support. And we do have the website in the chat right now for easy access to it. Is really to provide the information that people can empower themselves to make to have more control over their care and the outcomes. And so we have a few different things. Under the resources tabs, we
Mhm.
have patient brochures that these often go into those kits that I was mentioning. So they talk about side effects like dry mouth, mouth sores, product selection, and those simple tips of things that you can do to help yourself. Uh, so that's under the resources. For providers, we also have a free resource that is a checklist that can help with communication when they are coordinating care with the oncology team, and a companion guide to help guide them a bit with their treatment considerations, pre-treatment, during treatment, and post-treatment. And then the blog sections, we have those split up also for patients in more layman's terms, providers in more technical terms. And you can go there and it's just pages and pages of free information, which could get overwhelming, but there is a filter by bar. So if you want to look up something like dry mouth, you can put that in the filter by and it'll help to narrow down the articles that deal with that specific subject matter to help make it less overwhelming as you're looking for what you need.
Perhaps there's a hygienist in the UK that maybe wants to partner with you and bring all this information to the UK.
Yeah, in fact, there is a fabulous hygienist in the UK that I have shared some of her resources on there. So it's amazing how
You
many
can
people,
collaborate.
yes, great collaboration. Even though there is such a need, there is an awareness of what a need there is.
Okay, so in addition to a nice soft toothbrush with a compact head so that you can get it in every nook and cranny of your mouth gently, and then you talked about a good toothpaste, a non-inflammatory rinse, and so on. Are there any other home care techniques that you recommend other than brushing, flossing, rinsing, anything else?
I think a real valuable tool when people are in their survivorship years. So probably, we have to be very cautious during the treatment process when blood counts are low. So sometimes even flossing or using some of the other tools can not be advised during those times because you can be very at risk for uncontrolled bleeding if your platelets are too low, or infections if your white counts are very low. So once they're in their survivorship years, I really like water flossers. I actually do some work with Waterpick as well, where I provide educational programs to dental offices throughout my area of Wisconsin. And it's an amazing tool, especially for people that have dry mouth issues.
I love my water pick. I also find that sometimes the shooting of water can be a little harsh. Could you hurt yourself with a water pick in those tender times?
Well, and that's where that you have to be cautious during those tender times. So that's the nice thing. They have a wide range of their settings. They typically go from 10 to 100 psi. If you're not at risk for the oral mucositis and the blood counts, you ideally want to have it into the medium or up into the little higher settings. But for people that they're tender, there's nothing wrong with keeping it at a lower setting and still
Is
getting
there
that
a technique
irrigation.
that you could tell us about? Do you get that nozzle between your teeth? Is there a technique for using a
Yeah,
water flosser?
there's a standard tip called the precision tip that is good for everybody, and it comes with all the different models. And sometimes it comes with several of them that you can use. Different family members can use them because I'll have a colored band to show whose is whose. But that you actually want to take at a 90-degree angle and just slowly scallop it along your gum line and pause for about 3 seconds at each space in between the teeth. And you can do that from the cheek sides of the teeth, and you can do that from the tongue sides of the teeth. And then they have other specialty tips that are more for unique situations where it's not going to be the right fit for everybody, but depending on what your specific needs are, then they have different tips to help meet those needs.
That was very helpful to understand. What toothbrush would you recommend? What are the good soft toothbrushes out there?
The ones that I carry on my website, actually, I have a few of the toothbrushes here. So I first want to show you something you probably want to avoid, and we'll see how well you can see this. One thing to avoid is a really large head on your toothbrush. It's important to have a small, compact head in addition to the extra soft toothbrush, the bristles, because
Oh,
that's going to help. Number one is going to help make it easier to access all the difficult to reach areas. So one example of a really difficult spot for people that to reach and usually gets missed is the cheek sides of the top molars. And one of the reasons is people often will open their mouth really wide. And when you do that, your jawbone moves forward. So you can actually hit your jawbone before you are able to swipe that toothbrush around thoroughly around the cheek side and the back side of the tooth. So one of the tricks for that is whatever side you're trying to reach, close down about halfway and then shift your bottom jaw over to that side. And that's going to take your jawbone back and to the side and give you access. And that's going to reduce your risk of toothbrush trauma because you have to be very gentle. And this could be a way that you could traumatize your tissue and also start that inflammatory process. So you want to stick with a smaller head. The ones that I have on my website, I carry a one from Sunstar. It's called a gum post-operation brush. So this would also be something that if people had surgery on their gum tissue or things like that, it's super, super soft bristles and a smaller head than what's available here. And I also do carry some brushes from a company called Tepe. And that too has a very small head, very, very soft bristles. There's a Gentle Care brand or Gentle Care, and this one is called the Special Care. And another brand that I currently don't carry, but I am also a very big fan of, is Curaprox.
I was
Um,
just going to ask you about that.
yes, they're
It's a European
wonderful.
company, isn't it?
Yes, yes. And these are some examples of, so this is the Curaprox Ultra Soft. They have these nice little compact heads. I believe they have one called Velvet as well. That's really gentle. So that's really, really a great brand. And this is an example of a specialty brush that they offer. It's called the Curaprox Surgical. And this can be nice and small, a little bend in the handle, and to help reach around those hard to access areas. Another spot to be aware of is the tongue sides, the bottom teeth. A lot of times that area gets missed too. So the smaller head makes it a little easier to reach in those areas.
You know, Jill, I have never heard this information from my dental professionals in my entire career in dentistry. So this was incredibly eye-opening about the expertise that you have.
Well, it's that's the one thing is a lot of these issues are so complex, but the things we can do to help can be so simple sometimes. And unfortunately, it's those simple things that just often fall through the cracks. And we get so focused on the complex things. So with side effect support too, that is one of the goals. I mean, the provider section has a lot of technical information in there, but even for that, I try very hard to take some of that technical information and break it down into more simple, easier to digest, and something more that you can take action with.
That's brilliant. Is there anything else that I didn't ask you that you want to share with us? Because I have found this really educational and
Oh,
we
I
appreciate
appreciate
your
that.
time.
One other aspect that we offer at Side Effect Support, I teamed up with a company called the Teledentist that people can actually access an online teledentistry service that's very affordable. And my main goal with that was if somebody's having a concern, that they can kind of triage the concern and get some professional advice and avoid an emergency situation. Especially if a lot of times people will end up, waiting till it's too late and they go to the emergency room. And that's definitely not a place that you want your dental concerns addressed because they really don't have the training for that.
None at all.
Right.
In fact, when you go to a hospital here in the United States, they give you the hardest toothbrush that I have
Yes.
ever felt in my life. I mean, all it can do is really potentially cut your gums and then introduce infection because you're not used to even using such a hard, sharp toothbrush.
Right. And sometimes the toothpaste not only has those irritating chemicals in it, a lot of times the flavoring, especially if you have nausea issues or you have tender tissue, can just be too much to tolerate. So with side effect support as well, we do have um, the online shop. I don't have the ability to ship to Europe, but in the States, we've got the direct to consumer sales, but I also have what's called a partners marketplace. So that's for companies that I've partnered with that people can have direct access to their products, oftentimes get a discount. I'm very aware of the financial concerns that come with a cancer diagnosis. I try really hard to lessen that for people so they can access a discount And then it also helps that if they use those code, a little bit of that sale comes back to side effect support to help keep our services running.
Well, Jill, thanks to your mother's diagnosis, you are making a difference in the world. Thank you for all you do. And if anybody has any other questions to ask Jill, she'll be available through her website. Thank you, everybody. Have a great day and join us next month for Mouth Matters.
Thank you.